all for inviting me to speak today. Very excited to be speaking with Lisa Fitzpatrick from the Australian Nursing and Midwifery Federation.
That's right.
Back in the old days, it was just the ANF.
That's right.
And I was very proudly an ANF member from the day I started my nursing. So, I've been a registered nurse for, sorry, I will use my notes because I have a really bad habit of speaking and not using all these notes that I've created and then completely forgetting something, so I'm going to use my notes. I've been a registered nurse for 35 years, both working in the UK and Australia, and I've just recently, or 12 months ago, gone back to working in the NHS. I'm out of the NHS for about 12 years, so I've sort of been given a really amazing opportunity to be able to really see quite clearly the changes that have happened in the NHS in that time, both good and bad. But really to just give you a bit of an idea of what happened in Melbourne all those years ago. Obviously, I'm from Australia. I trained in Melbourne. I trained at the Royal Children's Hospital from 1975 to 1979. Back in the days when we did 3.5 years of training. Well before any of you were born, which depresses me no end, but it's okay. I also worked at the Royal Melbourne Hospital, and I did intensive care at the Alfred Hospital in Melbourne. And as I was mentioning before, today's actually 17 years to the day since I moved to London to live. And I always knew there was a reason for it, and I reckon it's sort of starting to show itself now, which is good. But just to take you back through some of my memories and some of the involvement that I had during 1985 and 1986. During 1985, as I say, I was working at the Alfred doing intensive care training, and they, for me, were some of the first stirrings of action that was being taken in Melbourne by nurses to protect various things we were doing. Of course, to protect patient safety and patient care, but also to help ourselves by protecting our pay, protecting our conditions, improving our pay and our conditions. The decision that we took to take action was certainly not taken lightly at all. And I have to say that the majority, if not all of my colleagues certainly, were more than happy to be involved in the action that was taken. There were very few nurses who weren't involved. During 1985, towards the end of 1985, we implemented sort of work to rule campaigns. We did no overtime. We stopped non-nursing duties. We were starting to get very involved in, writing up orders for bloods, all the sort of things that doctors had been doing. And so we stopped doing all of those non-nursing duties. We stopped wearing uniforms for a while, which was interesting in ICU. And we set up, there was a campaign that set up called Keep Nurses Nursing. At no time during all of the events certainly that I was involved with were patients put at risk. Absolutely at no time. And I really want to make sure that really gets home here, because I think that's a big fear for a lot of nurses to take any sort of actions that patient safety may be compromised. From my memory, the public was very much behind what we were doing, and we probably had, again my memory, we probably had problems with the media then, but I'm pretty certain that the public was very much behind what we were doing. In 1985, the action that we took then was pretty much the precursor to much more widespread and much larger action that was taken in 1986. And I just read something I found from the ANF archives, that a bit of a paragraph about what led up to the 1986 strike. During 1985, nurses had taken action in response to their concern over wages, their career structures, and their objection to non-nursing duties through the Keep Nurses Nursing campaign. Nurses worked out of uniform and refused to engage agency staff. On October 11th, 1985, Victoria branch members resolved to strike indefinitely throughout Victoria from October the 17th onwards, in objection to the ongoing obligation of nurses to perform non-nursing duties. Having voted to remove the no-strike clause from the branch rules in 1984, this strike marked the first time Victorian nurses had ever voted to strike. The strike lasted 5 days, but served as a precursor to the 1986 action. When it comes to 1986 action, I very clearly remember sitting outside the Department of Health in Melbourne in my white frock. Hundreds of us there, I don't know how many of us were there, but hundreds of us were there. And I remember we had signs saying, people driving by saying, tootingly support us, and just the sound of cartwoomans tooting and supporting us, and that just kept us going. It really, really kept us buoyed up as we realised that people were supporting us. We were chanting and we were yelling and screaming, and at one point we were mostly chanting about things like, what do we want, better conditions, where do we want them now. But by about 5 o'clock we did get to the point where we were chanting, what do we want, gin and tonic, where do we want it now? It's 5 o'clock. But our aims during that time were, at all times really, were related to patient care and patient safety, and the fact that there were issues with the number of staff, number of nurses working on wards. We were concerned about staff-to-patient ratios, we were concerned about outpaying conditions, and again, we're still concerned about the non-nursing duty issues. Lisa will be able to provide you with much more detail about the events at the time, and I only have my memory, but I do remember how important it felt to every single one of us. It wasn't, as I said, it wasn't taken lightly at all. Very few people refused to strike, and the response we got from the public was really quite incredible. Looking back, I don't think I had to think twice about going on strike. I do remember speaking to my mother and father, and I was brought up as a Labour supporter, and always had it firmly instilled in me by my parents that it was important to work hard and do a good job, but to stand up for your rights as well. And I know that my family and my friends were very much supportive of everything that we did. I think we must remember though that action is taken not only to ensure patient safety and appropriate care for those that we care for, but because we need a strong, motivated and adequately paid nursing force to care for those patients. If we aren't cared for, how on earth are we supposed to care for those other people? So what about where we are today? I, for one, am really getting very tired of seeing media reports using the words care failings, because every time that phrase is used, it implies nursing care failings, and that's how people read it. And I'm really concerned that people aren't speaking up about that, that we as nurses aren't speaking up about that. Why we're accepting this, still being reported every single day. I mean, nurses are the backbone of healthcare, there's absolutely no question. If there are insufficient nurses on ward, and by that I mean both the numbers and the skill mix of the nurses, you'll have inadequate care. There will be care failings, it's not rocket science, it's how it works. Depending on which articles you read at the moment, it's estimated that anywhere between 4,000 and 6,000 nursing posts have been removed from the NHS since the Tory Deb government, that's probably, came to power. And that's all been in the name of saving money. Some reports, something I read just the other day, suggested up to 20,000 posts, so it's a fairly wide distribution of numbers, but obviously there have been a lot of posts that have been removed. There have been lots and lots of reports and surveys that conclude that the staff-to-patient ratio, and not just the number, but the skill mix of staff, is vital for safe patient care, and yet nothing's happening. The Francis report, I'm sure you're familiar with, following the Mid-Staffordshire Trust failings, which were significant. The care report that followed up from that, lots of other reports have made similar recommendations about how staffing should be undertaken in hospitals. The report of the National Advisory Group on the Safety of Patients in England that was published in August last year, which was set up as a response to the Francis report, also focused on NHS staffing levels, and one of the recommendations in that was that Government, Health Education England and NHS England should assure that sufficient staff are available to meet the NHS's needs now and in the future. This has led to the NICE draft guidelines which were published last week, the 8:1 ratio. Those guidelines are in consultation phase at the moment. The consultation goes till the 10th of June. So I urge you to read that and certainly to make comment on it, absolutely. But to look at what's really happening underneath all that, a very interesting article that I read the other day. I don't know if any of you are on Twitter? Twitter? Yeah, Twitter. If it wasn't for Twitter, I wouldn't be here. There's a chap who's a very well-known healthcare commentator called Roy Lilly, and he tweets quite prolifically. And he also writes an amazing blog that you can sign up to and get emailed every day, every couple of days he writes. And the other day he wrote that he had received, last Saturday, he received an email from a nurse. And the email said, "I've just finished a 12-hour shift, 1 nurse to 14 patients, no time for a break, I'm exhausted, I know it's not safe, but what can I do?" Roy then raised these guidelines that have been brought out from NICE with the 1:8 ratio. And he mentioned in the article, which I've got here if anybody wants to read it later on, that of course it works out 1:8 ratios that nurses would have 7 minutes for each patient per hour. And when you put it like that, we know it's not allocated like that, but when you put it like that, you think about it like that, and that's the basic sort of ratio. So that's just utterly ridiculous. And this sort of leads me to, I suppose, to what's really happening with the NHS, with the funding cuts that are occurring at the moment. And because they don't only affect the number of nurses at the bedside, they affect the entire system by setting the NHS up to fail. And of course that makes it much easier for the government to sell off the NHS to the private sector, which is essentially what's going on at the moment. Despite all of the promises that David Cameron made before they were elected, no top-down reorganisation, I'm going to leave the NHS, I'm going to improve it, I'm not going to touch it. The government are pushing forward the agenda of privatisation very dramatically and very quickly. And as a recent report that came out says that up to 70% of contracts for services in the NHS have gone to the private sector in the last 6 months. 70% of contracts. It's a very calculated and strategic way the government is cutting funding, running down the NHS, including running down nurses, and preparing to sell off the NHS to the private sector. If you think about it, this is actually how the railways were set up to fail, before they were privatised. What really gets me though is every day you hear about people who, companies and individuals who avoid paying tax through various loopholes. That broke the other day, the singer, what's his name? Yeah, thank you. And you know, if you think about how much tax avoidance there is in this country, if a small percentage of that tax was actually clawed back by the government, there would be more than enough to fund the NHS without problem in the world. I was asked recently during an interview if I felt that nurses should be involved in politics, which I thought was sort of an interesting question. I mean, it's not for me to speak on behalf of nurses, but I do think that we should all be much more aware of what's going on and what's going on with the NHS, what's happening to the NHS, and how we can have an effect on it. More importantly though, of course, is all those things that are happening to the NHS and to us as a group has a direct effect on patient care. And I'm sorry, but if you're a nurse and that's not the main reason that you're there, you probably should get out. When I speak to colleagues about what's happening with the NHS, and certainly mentioning Twitter again, the comments that you see on Twitter are incredible. People, sometimes they understand, but really they don't get a full understanding of what's going on. But more than anything, they're very frustrated because they just don't know what to do. They don't know how they can stop these things happening. I'm currently standing as a candidate for the National Health Action Party, which by all means, please take as many of these as you'd like. Get them out at work, plaster them all over the place. In the European elections, which are actually next Thursday. There are local council elections in England, and in London, we can only stand in London because we haven't got the funding to stand elsewhere. But we're standing candidates in London for the European elections. And so if you're able to vote next Thursday, there will be on the ballot for the European elections, there'll be a box just for the National Health Action Party. You don't vote for the individual, you vote for the party. So I'll be very grateful for your votes. Thank you very much. And the party, the National Health Action Party, was set up by a couple of doctors predominantly because they were so concerned about what's going on with the NHS, and is finding that's the only way to really fight back. It's fight fire through a political party. I'm doing this because I'm so angry and frustrated and really, really concerned about what's happening, not just with the NHS, with this country, but particularly with the NHS. And I couldn't sit back and not do anything. I'd just like to close by reading your comment that our lead candidate, Dr. Louise Irvin, who's the lady in the very fetching pink there, made last night when I was talking about being here today. And we're just in the process of developing our policies for the general election, and there will be nursing related policies in there that I'm just starting to put together now. For the general election next year, we will stand lots more candidates around the country. But Louise made a fantastic comment, and she said the NHA party, the National Health Action Party, would support nurses if they decided on strike action. We know that it's hard for nurses to strike, but that just means that when they do it, it must be because the situation has become untenable and there's no alternative for them. This would reflect a very significant shift in nurses' thinking. It would be even better if there was coordinated action across several sectors, as we were talking about before. That would have such an impact that you wouldn't have to strike for very long to win. There's a close link between nurses and other health workers' pay and conditions, and the quality of care and continuity and supply of good staff, and ultimately with privatisation and cuts. They're all interconnected. It's absolutely right. So, in closing, I'd like to just borrow a phrase from the Australian Labor Party campaign of 1972. It's time. That was the amazing campaign that the Labor Party used. So it just said, it's time. And it is. It's time to stand up for our patients and ourselves.